Good morning, everyone. It is Monday, January 10th. Welcome into the Morning Medical Update. Thank you for joining us on Facebook and on YouTube. Today, the Omicron and Delta surge is not only taking a toll on hospital staff, it is impacting schools and small businesses. And this week, it could be even worse. A senior economist at Capital Economics expects 5 million people to call in sick. That's nationwide. And this is all thanks to the Omicron variant. We will explore what is being done to minimize the impact on your health, your wallet, and your family. So make sure you get your questions sent into us on YouTube, Facebook, and on the Medical News Network. You can find links to those right there on your screen. But first, let's get to our numbers with Medical Director of Infection Prevention and Control, Dr. Dana Hawkinson is in with us. Good morning to you. How do numbers look coming out of the weekend?
Hi. Yeah.
Hi.
The numbers aren't too good. We have 119 active infections, 18 of those in the ICU, 13 of those on the ventilator, 43 still in that recovery period, but a total of 162. Just as a note from Amanda Cackler, our record high of active inpatients was 115 on December 10th, 2020. So we've surpassed that. Of those people that are in the hospital, of the 119 active infections, 11 of those patients are fully vaccinated. We continue to have deaths. We had 2 inpatient deaths on January 9th. And overall, Steve, unfortunately, 13 deaths to date in January of 2022. And we do see people, and we've been asked questions, the people in the hospital are just coming in for other reasons and they're just testing positive. Again, I think that's a myopic view. That is not taking in the totality of the information. I was working this weekend and overall had to see 4 new acute COVID patients. And that is in combination with my other colleagues that were working as well. And so, just saying that, the people that are coming in are just testing positive, they truly don't have it, really, that is not having a grip on what is truly going on with these patients in the hospital.
Yeah, I think that's key, Hawk. I'm glad you brought that up because we do hear that from time to time, that you just guys, you're just not, you're including all the wrong things because people who are there are just spuriously testing positive. They're not really here for COVID.
Yeah.
What I'm going to tell you is that's not true.
That's not true.
And we've told you all along we're not going to flapjack. We're not going to flap our arms and jack with the truth. And we're not going to do it now either. And the reality is that the overwhelming majority of our patients who are COVID positive are here because they have COVID. If they didn't have COVID, they would not be in the hospital. It is not a spurious finding. And so I think we just have to get past the made-up news network and stick to the real news, and that's what we're doing. We're going to run with the truth. Yeah. And I think that that's how we've made our mark the entire time, and we're going to keep making that mark. And I think the other thing to remember is that things we've told you have largely come true because we tell you the true stuff. So, Hawk, that's a pretty steep curve. Do you think this is Omicron or Delta right now?
Yeah. I think we are probably now getting into more Omicron. Unfortunately, we know that from community to community it's a little bit different. We have a little bit more of not necessarily the sequencing itself, but some information from KDHE and Health and Human Services where really on this side of the state, it really tends now to be probably more Omicron. And we should just say that while some people do come in for other reasons and do test positive, that is infrequent at this point in time as well. But I'm thinking we are getting to more Omicron.
I think we probably are. It's interesting because hospitalizations we know are more prevalent with the Delta variant. We've seen there are a couple of encouraging pieces of news. Dr. Fauci is talking about how this we'll start to hit the peak by the end of January and see it run out a little bit. That would be great news if indeed this is all Omicron. The other interesting thing, I was looking at the curves of South Africa. The curve in London, a major metropolitan area, shows a rapid rise, not as rapid as what we're experiencing, let's just say that. But secondly, after a short period of time, they did crest and then they started to fall again, which is a little different than some of the other outbreaks of different variants. So it maybe we'll experience that, but just to say, what we're seeing in New York is still a lot of hospitalizations. I'm guessing that we're going to be a combination on hospitalizations of Delta and Omicron, but that the majority of spread in the community is still Omicron. Yeah. My fear is what's going to happen with all the Omicron inside nursing homes and some of these other places where folks are more vulnerable.
Yeah, exactly. And I think if you were talking about curves, I look at the Washington Post curve a lot, and I know you do as well New York Times or CDC. We have seen that steep increase in cases. Hospitalizations, luckily though, for the most part, deaths are holding fairly steady, not on the same trajectory, not on the same incline. But again, if it's you coming into the hospital, or if it's your loved one or a friend, that impacts you as an individual. Again, these are population-based and large number-based curves, but for an individual or a family, that impacts a family greatly.
And remember that the average age in South Africa is a full decade less than the average age in the United States, and that's going to make a significant difference. At least it does with just about any other disease we face. We also have a lot of vulnerable people in nursing homes, transplant patients, advanced heart disease patients, and things, diabetes, hypertension, obesity, the things that we know are going to cause difficulties for us. So these national statistics are important. I wonder, though, where do you think we're going to head over the next 2 to 3 weeks, Hawkeye? What's your sense of where we are?
Right now, I think the spread is so prevalent. I think we're going to still see an increase. I would really like to see a decrease in the number of cases diagnosed coming up soon here, maybe by the end of January. We have seen those forecasts. You just mentioned that, or first week of February. However, also remember when these increases in cases were going on, it was during Christmas break for a lot of schools, whether that's colleges and or elementary and high schools. So now we are going back to those schools. We know a lot of the public schools are not having masks. We know that there are masks options where people can do that. But I think we are getting it to now where we have to see schools starting again, and there could be a lot of spread there. My real major concern for that is all of the children that have to be out for quarantine or isolated because they have it, but also, again, the adults in the school that are out. And if you don't have teachers, if you don't have people to help run the school and do those things in the school, then that makes it difficult as well.
Well, and I think the wastewater testing last week pushed the 80 to 90% mark for Omicron in our area, and we know that the data around that lags behind. So I think that the patients are going to be mostly Omicron. I think people going forward, I think that the folks who are saying we don't need a mask in school, I think that is a prohibitively bad idea. Because if you want to keep kids in school, you got to keep teachers in school, you got to keep administrators in school. Wait, you got to keep the kids in school, and the way to do that is to mask. You're going to completely undermine your ability to keep kids in school if you don't mask. We're seeing that locally. We're seeing that across the world.
Yeah.
It just is the reality, and and it's an unpleasant reality. But denial of reality doesn't make the reality untrue.
Yeah, I would agree.
In fact, it's going to make it worse.
I was going to kind of say it in the same thing in just different words. It's a matter of what do you want to prioritize. Do you want to prioritize the reality of the science, the information, the data, or do you want to prioritize other opinions? And I think that's what it boils down to, Steve.
So, Jess, do you want to go ahead and introduce our guest today?
I do. Let's check and see real quick if there's any reporters on the line. Okay, we are good. Okay. Yes, go ahead, Heather.
Oh, I'm sorry. Heather Hollingsworth with the Associated Press. Could you talk to me a little bit about some of the folks you have sort of filling in unusual roles, what they're doing, kind of how you're getting through these staffing issues you're having right now?
Let's do that. But just that, we should introduce our guests as we do that, because I'm going to turn to Chris Reuter, because, you got the Forehead brothers up here, and we're going to shine.
You are. Yes. Okay. So we have, he needs no introduction, Dr. Steve
Stites. I practiced that last night.
You did. You had it all planned out. I love it. Okay. Chris Reuter, he's the Chief Operating Officer here at the University of Kansas Health System in our Kansas City division. So we're so glad to have him with us today, along with Dr. Stites. And then Joe Reardon is the President and CEO of the Kansas City Chamber of Commerce. So we're so glad to have all three of you answering questions today. So Dr. Stites, I'll toss it over to you, but I'll let Heather go ahead with her question this morning.
Okay, Heather. Go ahead and ask that question again, Heather. I really interrupted you with my Forehead brothers joke.
Oh, yeah. My question is, talk to me about how you're getting through these staffing shortages. I understand there are some folks that are filling in and sort of, ways that they secretaries might be doing stuff on the, helping nurses. How are you all making it through with so many people out with COVID? And if I've missed it, how many people are out today?
You bet. Well, let's turn to Chris Reuter here, because Chris and I go back a long time, and he does a great job. And by the way, Joe Reardon could be an honorary member of the Forehead brothers, and I think Hawkeye's on the way. He's not there yet. But having said all that, Chris, let's address the question about our staff, because we've already cut a lot of surgeries, and we had to cut some elective surgeries last week, or they're not really elective, they're surgeries with an admission, those aren't really elective. And we've actually held back on procedures to free up staff. We canceled clinics in order to free up staff or deferred those appointments. How are we doing with all that?
Yeah, good morning. So we are putting plans into place that we had actually back at the beginning of the pandemic, looking at those and making updates continuously. So to address the care at the bedside, we're moving all individuals with clinical competencies to that direct patient care role in every way that we can. And so that may be a nurse that recently was providing care at the bedside, is now in a different role, but has maintained those competencies, so that person is coming back into care at the bedside. We are shifting staff from areas that can support the supportive functions of direct patient care. So that may be running a lab, it may be a simple patient transport, those types of things that we can use other individuals to help with. We're shifting staff to those areas. So I think over this weekend we had over 850 staff out, either isolating because they're positive or they were testing. So it's obviously a big number. We've got to supplant those individuals at the bedside in every way that we can, and I think we're doing that really in a very effective way, and our staff have been incredibly flexible to do that.
And that's been really helpful. And you know, Hawkeye, we shortened the waiting time once you're positive from 10 to 7 days for isolation. We didn't go to the CDC thing about 5 days. Talk to us a little bit about why we stopped at 7.
Yeah, I mean, I think there were a variety of reasons the CDC made those changes. Number one, they were really concerned about the workforce and people being home, but wanting people to come back. And they do understand that really the best data that we have really since the start of the pandemic is you are most contagious those first 1 to 2 days prior to any symptoms, and then 1 to 2 days after that. And after that time, your ability to transmit and your viral load goes down, probably even more so a little bit if you're vaccinated as well. And so that was the reason. But we also do have pretty good peer-reviewed science showing that that is not fully always the case. Even in vaccinated people, we know that it's probably around 5.5 to 6 days where you have that until you have that really lower viral load. So medically, it's just a little bit different. I think there are other reasons and priorities in the CDC doing that. Obviously, they want to help prevent the spread as much as possible, but we know that there are economics involved, workforce, things of that nature. We feel and we felt, obviously, there were big discussions within the health system about that, and that this was the safest because of the high-risk patients that we deal with and wanting to keep the rest of our employees, but also the patients, as safe as possible.
Yeah, and I think one of the things is that we work with a vulnerable population. Yeah. We want to have patients. We want to make sure that they stayed safe. If we ever get to true crisis standards of care where we have to triage people, then I think we'd have to relook at that question about that. So, Heather, does that answer your question?
I'm bad at muting and unmuting here this morning. So yeah, I mean, can you anything like, is this work? Well, okay, there were 950 people out, I believe, Friday. I just heard that there were 850 out over the weekend. Does that mean it's getting a little better?
Well, I think it's gotten, so, you know, I remember looking at the curve on Saturday, and one of the things we look at is our own rolling 3-day average and how many people went out that were new out that day. You would say, well, the numbers went down a little bit or they flattened, except that we switched from a 10-day isolation to 7. So we artificially helped it a little bit. So I was just watching the jump, and the first day was only 22, but the second day it was up more again. And so, Chris, I think we don't know yet if them are really getting better amongst our staff.
No, I don't think we do. That change was the thing that we saw over the weekend. When you look this morning, actually our 7-day rolling average is up higher than it's ever been. So I think what that tells us is we're still on the trend upward in terms of employees being out.
And what we're seeing in Kansas City. And I think our employees reflect the population of Kansas City. The numbers are still skyrocketing up. And, you know, we've hit our highest number of acute inpatients ever. You know, we're 2.5 years or 2 years into this darn crisis, and it's still rising. And so that, you know, that concerns us. Now, what I will say is for that 119 patients, back at the beginning of acute patients, I think we would have had more people on a ventilator. I think we'd have more ICU patients. So I liked the fact that their actual total number of ICU and ventilators hasn't skyrocketed as well, which I think that just means, okay, it probably is that. I think we've got this transition going Delta to Omicron here in the hospital right now. Other thoughts, other questions from reporters? So, Chris, I'm going to ask you a question. Do you think it's true? Does it feel like to you that Omicron's not so bad?
No.
No, nah, me either. Thanks for saying that.
So,
don't have to walk you back.
No. Couple things come to mind. You know, I think number one, we've been saying this for a long time, we have to look beyond ourselves. We know that getting the virus is also the potential to transmit. And so the vast majority of our patients that are unvaccinated and in the hospital. So Omicron is increasing the numbers. It's increasing the hospitalizations of those that are unvaccinated. So the second piece there is looking at the big picture and the number of hospital beds across our city that are not available for care for other patients. And that obviously is a significant concern. And so when you look at the whole big picture, Omicron is bad. It's putting us in the situation we're in currently today without the ability to provide care across our country in areas that really patients need. And that's the most significant thing. It's not just the number of patients who are in the hospital with Omicron or Delta, but we're in a seasonal time where the flu and other viruses are on the uptick. We've got some of those hospitalized patients too, and of course the general demand of patients that need care in a hospital.
You know, it was interesting. Last week we had the conversation. We've had to defer a lot of procedures, a lot of electives, a lot of even starting to defer same-day surgery cases, as well as those who have to come in order to help, and clinic appointments in order to help people, so we can make sure we can staff all these inpatients. Maybe a little light at the end of the tunnel last week. We felt like we were doing a little better with some of that support, folks coming over and thinking about, gosh, can we actually accelerate a few of our surgeries this week again, which would be great news.
Yeah, and so that's kind of the planning that's in motion right now. How do we continue to bring back, some of those early staff that were out ill? They're starting to come back because they reached either that 10-day period before or now the 7-day period.
Yeah.
So we'll start to see some of those individuals come back. We didn't have that effect last week. It was just one way. Everyone was going out ill. So we're counting on that, people coming back after that 7-day period, and they feel okay to do so. And then secondly, yes, the plans to shift resources to be able to support the care at the bedside or in our clinics, in the perioperative and procedural areas, that is having an impact. It's doing the right thing. So what we're hopeful this week is that we're able to see some additional surgeries come back and increase that volume. We're looking at that every day to make sure that we can maximize and really keep a balance of both things. Keep our staff safe, keep the right care happening, but also continue to provide as much care as we can.
Well, why don't we bring in Joe Reardon and talk to a little bit more about some of the things that are going on out in our community. Joe, what are you hearing from the business community about people having to close or to reduce their volume of business, or how's it going out there?
You know, everything that you all have been talking about relative to the health system is going on across Kansas City at every level of business. And so this issue permeates business overall. And I think you're seeing businesses reacting to this in certain ways, which is important. For instance, for the chamber, we're in the business of bringing people together. So prior to the holidays and Omicron, we had loosened mask restrictions and bringing folks into the offices and that sort of thing. And, starting at the first of the year, we're back to mask wearing for anyone that comes to the chamber offices. We're asking those that are coming to meetings to be vaccinated to try to control the spread. And I think you're seeing businesses across the region sort of reacting to what they're seeing and then making decisions about how to deal with that, whether it's coming into the business, wear a mask, whatever it might be. And I think that's important. We need to be respectful of businesses that are making those tough decisions to try to keep their employees safe and to try to keep the customers safe. And the bottom line is if we don't do this and we let the spread continue, you're going to see the notes on the door that say, we've had to close down because we don't have the staff. And so I think it's important to realize that this is something about keeping business open. And if you look at it in the U.S., 80% of small business has 20 or less employees. 90% have 10 or less employees. If you just have one absentee, it can destroy the business flow for the day. And so this is really important. And we're seeing businesses trying to make smart decisions and reacting to the moment in time. I do want to also say that while this is a moment in time issue, what COVID's done in the business world, in the workforce world, is it's exposed all of our vulnerabilities for the long haul. So we were having a hard time getting employees into jobs before COVID. And now COVID's exposed that the issues of getting people into employment are here for good. And I don't mean that in a good way. They're not going away. And we have to address the real issues to get people back into the workforce, both short term and long term.
You know, I was talking to a friend, an older friend of kind of the patriarch of a family, if you will, and had served a little bit in the Korean War and had lived through World War II, and said it reminded him a little bit of a wartime economy when you couldn't get things because all the efforts were devoted to the war, and now it feels a little like we can't get everything, like the supply chain side so interrupted. Is that what you're hearing from businesses? Joe, it almost feels like a war out there against this virus.
Yeah, this supply chain thing is so real, and we hear about the big issues. I'll just personalize it with the chamber. 6 months ago, we were due to replace all of our laptops for our employees. We placed the order 6 months ago. We just now got the laptops at the end of December. I mean, it's unbelievable how the supply chain has been affected, continues to be. And I think if you look at what Omicron's doing and the widespread absenteeism, I think we should expect supply chain issues to continue to be challenging across the spectrum. And they're not going to recover until we do two things. Number one, we try to slow the spread, right, and hope for this peak that you all were talking about. But secondly, for the long haul, we have to address real issues around people's barriers to getting back into the workforce, whether that's daycare, whether that's training. These issues are not going to go away, and they require both short and long-term focus, and that's critical if we want to get back to something that feels somewhat normal.
What are you hearing from schools and bus and about the teachers, bus routes, bus drivers? Man, it's got to have a really big impact on education.
It's a huge impact on education, and I've heard of one school district that had 200 absentees, right after the holidays. Well, there's not enough substitute teachers to account for that. So again, if we don't get this under control, you're going to see schools making a difficult decision, which we don't want to have to make them make, which is maybe the kids can't come back, right? Maybe we have to go virtual because we just literally do not have enough staff. That's happening right now. Those kinds of tough issues are happening across Kansas City with our schools. There's no doubt about it. And the other thing I just mentioned, childcare, because if this starts to happen, right, kids have to be taken care of, which means I have to stay home or my wife with our child, or you try to get them into childcare. Well, what COVID's done already in a really rough childcare situation in Kansas City prior to COVID, it wasn't great. 40% of childcare businesses in Kansas City have gone out of business because of COVID. 40%. So the issue of just getting kids into a safe place so that one of the parents can go to work is very real, and we're almost at crisis level relative to that. And so we really need to be, again, focusing on how do we rebuild some of this infrastructure that we've lost, even as we're dealing with COVID. We can't wait. We have to start doing that now, or we're just going to keep seeing this lurching, right, within the economy, within our schools, and we've got to try to get beyond it.
That's tough. 40% of businesses and things.
40%.
I don't know. That sounds really, really tough. You know, Chris, you were in over the weekend, I understand, doing some. Now you're the VP of Operations and the COO for this campus. So, I mean, gosh, what were you doing this weekend?
We've got teams helping out, as I mentioned, and so we had some great people in this weekend helping to do all the support functions that just need to happen in a hospital. And I will tell you, people were excited really to do it, to help. People want to help in all ways that they can, and it makes a difference. It just makes that operation happen that much more smoothly to support those that are providing care at the bedside. That's what this team does, and I think that's what we're leveraging, as I mentioned earlier, this week. How can we continue to care for as many people as we can these are the ways that we'll do it.
So I understand that you actually tried to tackle, you were playing like you were the Chiefs game on Saturday, you tried to tackle an ice maker on one of the floors and it tackled you back. Is that true? Is that a true rumor?
It's a true rumor, and look what I did to the Forehead Brothers. I put a blemish on our, I know, gosh, I'm so sorry.
Chris Reuter and I have managed to play flag football together a few times over the years, and I'm just going to tell you, I've seen him play. He's a great tackler. He's really awesome out there. But ice makers are tough, man. They're tough.
They don't bend.
They don't bend.
No.
Yeah. Okay, Jess. What do you think? I mean, how are we doing here?
I think you're doing pretty good in there. I like kind of sitting back and watching a little bit. I have a question for Joe. I'm curious. I'm going to ask before somebody on the line asks or on their feed asks. But what impact do you think Restaurant Week is going to have on businesses? And then ask our docs what kind of effect might that have on the surge?
Yeah, kudos to the Restaurant Association. I think they, during COVID, they've moved to, trying to make sure that people can participate in a way that's been comfortable for them. In 2021, it was a lot of takeout, that sort of thing. And that's what's going on this year too. So the idea is that whatever your comfort level is, you can come into the restaurant should you choose to, but delivery and takeout also is available. And so I think that gives the options to those that want to help. And so many of these restaurants are small businesses. We have to support them, there's no doubt. And we want to. And we want to enjoy what they're providing. But we have to do it in a smart way. And I really want to thank the Restaurant Association for striking that right balance and allowing people to do takeout and to do delivery as well. I think those are important options. But we have to be careful. We all have to be cautious. I mean, we want to enjoy, we enjoyed the holidays. And I think that, part of that was that Omicron spread during that period of time. And we want to make sure that we're doing all we can to keep the spread from increasing, even during Restaurant Week. But I'd encourage everyone to, pick up the phone or use Grubhub or whatever it might be. Participate in Restaurant Week, even if you don't feel comfortable enough to go out there and have a dinner at the restaurant itself.
Dr. Seitz, do you think does that concern you? What kind of concerns do you have when you hear that, or Dr. Hawkinson?
Yeah, so here's the thing, and first of all, I one of my chief sources of entertainment is going out to eat a really good meal or even going to Chipotle or whatever. I mean, and so we've stayed home because, my wife and I are both over 60 and we're feeling a little vulnerable about the rapid rise in Omicron. We still order out a couple times a week and enjoy bringing it home. And some restaurants have done an amazing job at both how they've packaged. They've changed things up a little bit and prepared their food, so it's really good. And so I think that's been great. But anytime people gather together in a public space without a mask on, it makes me nervous, Hawkeye. It's like that old thing. See no evil, hear no evil, feel no evil, there's no evil. Yes, there is evil, and the evil in this case is Omicron, and my fear is that if we don't take it seriously, to Joe Reardon's point, if 40% of daycare has closed, schools are going to close, we're deferring elective surgeries, I don't know how much more we can make people feel this is real.
Yeah, I would agree. I think, there are people out. I think a lot of the public continues to go about their daily lives or their daily evenings going to those public places, thinking, it's not going to have an impact on me because I'm otherwise healthy or I'm vaccinated. We want you to be able to go out and do things if you're vaccinated. That is a benefit because individually you are going to be healthy more likely than not, but just understand you still have that chance to spread to others. Right now there is such a high prevalence of disease and community spread that it does and it is impacting all of us. And so I think it's very important to continue these measures right now and try to be as strict as possible in doing those so that we can try to decrease this curve. Hopefully the prevalence will go down because we still have vulnerable populations that are getting ill, that are coming to the hospital. Just as you see, we've had so many deaths even in January right now, and we are only 10 days into January.
Yeah, no, we're going to have a lot of deaths, unfortunately.
Yeah.
We do really well. Our death rate for Omicron or for COVID overall is less than national average, but it's tough. Mm-hmm. And just to say to our COO, I think we continue to prove every day that masking works because our employees aren't getting COVID here unless the only time they ever get injured here is they try to tackle an ice maker. Other than that, it's really getting done out in the community.
I think that's right, and we studied that early on, obviously with contact tracing, and we are employing those pillars of infection control beyond masking. So keeping the right number of people in small spaces, not doing meetings in person right now. There are ways technology helps us to carry on our business, so we're leveraging those in every way that we can.
Dr. Stites, I think I want to get to some community questions because we've got some good ones, if that's all right, and a couple for our guests. So Joe, Isaac wants to know, he's noticed that some mornings his Ride KC bus hasn't come soon enough to get him to work. Is that because bus companies are cutting back on services due to shortages with staff? Do you know?
Yeah, I haven't heard something lately, but I know they were dealing with this issue before the holidays where they had folks that were like we all are experiencing. You've had drivers that are calling in and or testing positive, and that's caused strain. If there's anything that requires, a lot of folks to do their job every single day to make it work, it's a bus system. And so unfortunately, they're experiencing the high infection rates and the calls in with folks not feeling well. And I do think that's contributing to some of the issues they're having to deal with, yes.
Joe, another question for you from Ruth Ellen is, what are you all doing to get county, state, school board elected officials to hear your COVID concerns specific to vaccination and masking?
Yeah, I want to give kudos to KU and to all the CMOs. We've tried to stand side by side with you as you've done your presentations to the region that have been so impactful, and we've promoted all of those to all of our members, and we've had a lot of our members that have been online with that, but we've also encouraged elected officials across the region to be a part of those conversations and presentations with the CMOs. The facts matter, and this chamber wants to make sure that every elected official in the region is getting the facts about this virus, the facts about what's going on, and then using those facts to make smart decisions on behalf of community. So we're doing all we can, and we're in contact with our elected officials in a regular way to make sure they're getting the information and that they're understanding what's going on with business and the strain that's being caused by all that we've been talking about this morning.
Hey, Chris, maybe you could help us out with this one because Rachel wants to know, how staff are getting sick. Is it from the hospital? She's been quarantining because she's about ready to have a baby, but still has 2 more appointments at the hospital and just worries about getting COVID from inside the hospital. Can you just help her out with that one? We've always said that hospitals are one of the safer places to be.
I was just going to say that, Jess. I think this may be one of the safest places you can be. Everyone is masked 24/7. We're practicing all of those things internally that really keep everyone safe. And of course, especially our patients, we're limiting visitors. That's a hard thing to do, but we also know that there's a balance between making sure that we can support patients, but also have the least number of people inside the walls of our health system. So we're doing a lot of business virtually, and it's working well. So people that used to come in a lot from the outside, we can transact business online. And of course, as I just mentioned, all of the things that our staff take in terms of precautions between patient care from one patient to the next on the inpatient side or in our clinics is happening very consistently. We know that. And it's not just masking, but it's hand washing, it's distancing, all of those things that are important are happening. So I personally would be the most comfortable in a hospital. That's why I'm here every day, and I feel better here than when I leave and go out in the community.
And I'll just say something, just the other way to ask this question is, are our staff making patients sick? Because if we were spreading Omicron in the hospital, we would be spreading it to the most vulnerable group, which is a hospitalized patient who doesn't have Omicron, right? We still had 700 people in the hospital, and we may have 163 of them with Omicron, but that leaves the other 450 or 550, whatever, without. Are we spreading it? Is our staff spreading it to our patients? And the answer to that is no. We don't see that. And in fact, when we do ask people, where did you pick it up? Then inevitably there is some community contact that they got it from. And even in the age of Omicron, we know that we keep our patients sick, Hawkeye,
Yeah.
and that's because the rules of infection control
Yeah.
travel with you wherever you go, and they still keep you safe.
Yeah, we keep our patients safe. I think it's a great question so that we can reiterate that to the public, because I think the public does have a true concern about that. I think it's a valid concern to understand not just the hospital, but any situation that you go into. Am I at risk of getting this? But we do know, and we have seen this throughout the pandemic, and this has been vitally true, there is no safer place than in the hospital because of the measures that we're taking, and that is the masking, the gowns. We have cohort units for those people that have tested positive. All of those things that are in place, those systems that have been refined since the start of the pandemic, and really there is no safer place to come for a procedure, to come to get examined. If you are ill, you need to come seek medical help. This is a safe place to do that.
So yes, Rachel, please come to the hospital, get your last 2 appointments in, keep you and your baby safe. Donna has a question. She saw a report on the NBC Nightly News last night that had a story that claimed that cases being counted in the hospital aren't often being hospitalized for COVID. They are just testing positive for the virus, but are in the hospital for other reasons. Is that true? And can you kind of explain what those numbers mean?
Yeah, so here's the deal. That's made up news, right? It's the idea that really it's not that bad. We don't want to think of it as that bad, because what's happening is people are coming in, they just happen to be positive from COVID. They're not really sick from COVID, but they're just positive, and so that's just distorting the numbers. And that's why we tried to take this on at the top of this program today, that in fact that's not the case. That the overwhelming majority of our patients who are hospitalized with COVID are here because they have COVID, and not because COVID was found incidentally. And so we really, the data just is what the data just is. It's like trying to argue that vaccines don't work. Really, well, 90% of our patients here are unvaccinated. I mean, why do we have to keep having the same silly fight when the data is so overwhelmingly clear about the question? It's like folks don't want to believe that COVID is real and it's a made-up conspiracy. How would you have a made-up conspiracy across every country of the world, every hospital in the world? I mean, don't you think that somehow that would leak out? It just isn't true. If you just put a big lens on it and sit back and say, really? And the other thing is, we have a lot of people dying from COVID-19. Well, we don't make that up. Chris, that just is what it is.
It completely is what it is. There's no other way to look at it. I think that the data tells the story.
It's just frustrating, Hawkeye, and I know you guys in infectious disease see all these consults all the time. I think the COVID patients are sick with, COVID.
Yeah, and I mean, I think the true nature is that really it is our hospitalists. Dr. Brown, we've had Chris Brown on, his colleagues, and Melissa Parkhurst helps run that hospitalist group. They really take care of the vast majority of those COVID patients. Our ICU docs, your colleagues, take care of the vast majority of those patients. ID gets consulted occasionally because we need to come in with some more of the complex disease processes. But like I said, this weekend alone, I had 4 consults for COVID. There obviously are many more here in the hospital, but it just kind of owes to the nature of, well, these patients now are more complex. There are questions about how do we best go about it, because we've had the treatment modalities now really since the middle part of 2020, and that is remdesivir if you're in the hospital, steroids if you need them, blood thinners, baricitinib, which is just an immune modulator if you are sick enough to get that. It's been pretty regimented like other things in treatment, such as with influenza, but the fact that we are seeing them more as an infectious disease consult service just owes to the fact that there just are more patients in with more complex disease from this.
Joanne has a question. Chris, maybe you could jump in on this one. Is there anything a person in the community can do to help hospitals, to help alleviate the staffing shortages?
Well, I think we've said it. I'll repeat it again. The best thing we can do is mask and vaccinate. That will help us. Those things that we've talked about, and I think we've had some great community outreach to support our staff in lots of ways, and we're leveraging some of that each day. But I'm just going to go back to the most simple thing that we can all do, and it is what we've talked about for almost 2 years. That really will quiet this virus down, and that's really what needs to happen. That's the biggest contribution anybody in the community can make.
Wear a mask. Wear a mask, wear a mask, wear a mask. And you know what? We've bent the curve by distancing and masking multiple times in this community. We can bend it again.
Yeah.
Isaac wants to know, compared to prior variants, do Omicron patients tend to be discharged earlier than with other COVID variants?
Yeah, that's a great question. So in the hospital, we don't specifically look and try to do genomic analysis on every single patient. So it's a little bit of speculation, and so I don't want to misrepresent how much I know here. But we do. There is a group that seems to have a little shorter length of stay and get better a little faster. Is that Omicron? It's kind of early in Kansas City to make that statement, Hawk. So I know I'm a little reluctant to do it. It is what we're hearing nationally. It's what we've heard internationally as well.
You know, I have had a soapbox about this the last week, and Dr. Williamson will attest to that. But I think people are really, again, just as they're saying, people are coming to the hospital for another reason, they're testing positive. I think in this case, if you're looking at symptoms are shorter, they're getting out of the hospital, I think you're focusing on the wrong details. So what we have known and what we have said is that, okay, maybe Omicron from early data, I don't think it's a complete data set, would say that you are less at risk of going to the hospital compared to Delta. Well, remember, Delta was higher chance of going to the hospital than the original ancestral strain or ancestral isolate. So basically what you've docked it down to is the original Wuhan strain, and we know that was pretty good at doing quite a bit of damage to people, causing severe illness, going to the hospital. We know from some of the early molecular studies that although the spike has changed, it binds very well to our human receptors. So spike binds, you can still get infected, maybe not to the level of Delta, but the same as Wuhan. So I think the main issue here is that these viruses, these variants, are really all the same. They cause the same spectrum of disease. And I think if you're focusing on, well, it doesn't really cause that bad of disease, I think you have to remember the original Wuhan isolate caused pretty bad disease, and so that is the main focus. And I think if you're trying to focus on some of these other issues, it's kind of putting your energy to the wrong topic. And just understand that what we have seen, however, is that these vaccinations continue to provide protection against hospitalization, severe disease, and death. And we know that does occur with Omicron as well. And so I think it is very important to continue, just as Dr. Steit said, along with masking for vaccination and getting that booster if you are eligible for that booster. If you are that immune suppressed population, do you need that fourth dose? If you are eligible, get that fourth dose, because we know vaccination really does help. So I think it's really important to stay focused on the true topics and really what is the main brunt of everything, and that is public health guidance, masking, distancing, and also vaccination.
We have a few more questions, and Joe, I have a question for you about what are the positive and negative effects? Do businesses feel comfortable going against mask mandates where maybe they just put a sign up in the door that says that masks are required? We just don't see those very often. Is that something people are going to start doing, or do they just shy away from it because they know they're going to lose business?
Well, I mean, I think it's a decision that at this point where we stand, it's a decision that every business needs to make for the business itself, for the employees there, and for the customers, or those that are coming in. I would say, for all of us, if we decide to go out and interact, at a bare minimum, we need to be respectful of a business that is asking for those that come into the business to wear masks. And I think we've heard great advice today from the professionals around the value of wearing masks. And so certainly mandates, when they were in place, if they're consistent across a spectrum, takes away the issues around competitive nature, like you're a business that requires something and another one doesn't. But I think we're at a place right now in trying to bend this curve that businesses are going to need to make this decision. And I think we all ought to be respectful of those decisions relative to wearing masks in a business, if that's what they're requiring. And I think the best advice is to wear a mask when you're in public. We've heard that this morning, for sure.
Dr. Stites, Rebecca has a good question. Can you address that Omicron isn't necessarily more mild, because she feels like people are just running with this and using this as an excuse to not be as safe?
Yeah, no, that's true. I think it is true, Jess. People are doing that, and people are come to call it "oh my cold," trying to make it sound like a little bit of derision there, that it's not as bad. Here's what we know about Omicron internationally as well as nationally. It tends to have a little shorter length of illness. Especially if you're vaccinated, you may not feel as bad as you did with the Delta variant. Those are true statements. The other thing we believe to be true is that it tends to stay a little more in the upper airway and not get as much in the lower airway and into the lung, the deeper part of the lung, which is where Delta and the original strains and Alpha got in and caused a lot of severe lung damage, which led to a lot of ventilator and ICU care. So it may be a little less severe. But here's the problem. The problem is, A, the word is it may be. B, we don't really know the long-term side effects because Omicron's not been around long. Remember, long haul syndrome wasn't described for well over 6 or 8 months after people had the original strain or the Delta variant. And so when we look at Omicron now, we don't know what the impact on long haul syndrome is. We have no idea because it hasn't been around long enough. Third, maybe it is more mild, but that's a big maybe, and there are people who are dying from it. Now, which one do you want to be? Do you want to be the person who's going to play Russian roulette down at the gambling casino over your life, or do you just want to put on a darn mask? I mean, that's the challenge for us. If you just try to follow the rules of infection control, you'll probably you're going to have a lot better chance to stay safe. So it's just so early in the game, Jess, we don't know enough. We know some signs that suggest it may be a little less severe, but the problem is, A, if you have underlying chronic disease. B, if you get a really high inoculation of it. C, if you happen to be taking a deep breath while you get it. D, when you have cancer or a transplant or you're immunosuppressed because you've got rheumatoid, whatever. This disease can still be really bad. And we still have a lot of hospitalizations, which are Omicron, spiking throughout the United States. And to the point that hospitalizations aren't going up and deaths aren't going up. Deaths lag a good 6 weeks, 4 to 6 weeks behind the rate of hospitalizations. So don't even tell me about that yet. Give us until the end of January, and then we'll know more. But at this point, what we can tell you is, A, caseloads have never been higher in the community. B, we just hit our highest number of COVID patients ever. C, that's true around the country. Hospitalizations are rising. D, we don't know what's going to happen with death yet. So just be cautious. Just be careful. Don't be the person who has to come into the hospital who actually does have a lot of lung injury, who then ends up on a ventilator, and young people dying. And remember, talk about young kids. Children's Mercy last week set their highest number of COVID-19 patients they've had the entire pandemic. So, it's out there for everybody. Just be careful. Just be safe. It's not that hard. Wear a mask.
Well, and Dr. Stites, I think it's when we were calling it COVID for so long, and then we started differentiating between the different variants. And so when people say, I have Omicron, it's like COVID is COVID. Is that what you're saying? COVID is COVID is COVID?
We don't know enough, right? I know Hawkeye would be saying that. We don't know enough.
Yeah, there's no difference. Really, the inherent properties of this virus have been stable throughout the variants. If you look on covariants.org, where they do an excellent job of looking at all the variants, it's a website out of England, and those mutations or those changes that are present in Delta and Alpha are present in Omicron, and those things lead to reduced immune system responses, immune antagonism. Now, there may be some other compensatory changes that make it not so bad, but we don't know that. But we know those changes are there, and we know in Delta those changes can cause possibly more severe disease. So I think it is premature for people to say that this is different, this is lighter. I don't think that's taking in the full data that we have available. We are continuing to look for more. But I think you really just have to assume that really the whole spectrum of disease, for the most part, under the large umbrella of COVID, this is really the same. And if it has to go back to exactly the same type of disease that the original Wuhan or ancestral strain did, we know that was still pretty bad. But we can prevent this. Individually, you can help reduce and prevent this with vaccination.
Yeah, don't be a maybe. Lots of maybes.
Dr. Stites, couple quick questions. So, Chris, Joanne had a follow-up question. Do hospitals allow for community help from outside, people who are vaccinated? I know we have volunteers that come in. Are we allowing for volunteers to come in? How can somebody help outside of the health system?
That's a Chris Reuter question. My answer is always wear a mask.
Yep. Wear a mask, have to be vaccinated. We have had some volunteers and some retired employees that have come in and helped us. So we are doing some of that. Again, it's trying to make sure that we've got everyone protected. But I think our workforce internally is able to to cover the majority of those support functions. We are using some volunteers today. Again, I think the most important thing the community can do is what we've talked about, and that's mask and vaccinate.
And I would just say, Jess, we've been able, fortunately, with the governor's declaration, to bring some retired folks back and to use some medical students, different people in different capacities, because we don't have to always have licensed personnel now to do things we think we can do safely with someone else, Chris. So we are very appreciative of that, and I wish Missouri would do the same thing. I know the hospitals in Missouri need it. We're grateful we have it in Kansas.
Yeah.
Last question, and this is from Lesko asking if the doctors can speak to the statement made by the CDC stating that 75% of COVID deaths occur in people with at least 4 or more comorbidities. Does this simply mean that healthier people fare better with COVID?
Yeah, healthier people do better. But be very careful about the word comorbidity.
Yeah.
Because, if you, age can be a comorbidity, right? A little bit of diabetes, your high blood pressure, Hawkeye, a lot of these things people don't think about. Like I hit the 4 comorbidities already. I have sleep apnea, I've got prostate cancer, I've got some some gut problems. So at the end of the day, I hit the comorbidity index.
Yeah, absolutely. High blood pressure, kidney disease. If you're an otherwise quote unquote healthy person, say over 40, you've never been to the doctor, you don't necessarily know at this point in time if you have some undiagnosed comorbidities such as diabetes or pre-diabetes, hypertension, or high blood pressure. So I think that is an important statement that you made there, Steve. Again, I don't know the point of that question because we also know that people with no quote unquote no comorbidities or prior to that diagnosis of COVID didn't have any problems, but we know that otherwise healthy people can get severely ill and die, and we have seen this all throughout the pandemic. I think recently we saw in the news, in Casey Star, they just documented another gentleman who was otherwise healthy who died of COVID. So that happens as well, and I think the nature of that and just saying, well, I don't have 4 different illnesses, so I should be fine, I think is the wrong way to go about it as well.
Yep. Oh, hey, Jess, you may be muted. We're not hearing you.
I'm going to go ahead and let you get some final thoughts from our guests today.
All right. Thank you, ma'am. Joe, let's start with you. Final thoughts today. And hey, first of all, thanks for joining the show. Thanks for your help. Thanks for your ongoing support. We love working with the KC Chamber. Love working with you. So thank you so much. Final thoughts today.
Thank you. I hope we can continue to do great work with you, maybe under better circumstances over time. But
absolutely.
Final thoughts are for those businesses that are out there. We've done this over time since the beginning of the pandemic. If there's something we can do to help you, kcchamber.com is our website. Please reach out to us. We are here to help business in these challenging times. Most recently, we helped a daycare line up with a health resource so that they could get regular testing for their employees at the daycare. We want to do what we can to help, and we're here to do that. So please reach out to us and allow us to help you as a business survive this period of time and grow in Kansas City. We want that to happen. Thank you for letting me be a part of today, too. And
well,
thank you, by the way, to everyone at KU inside the hospital and the great and amazing work that you're doing, that you've been doing for such a long time. Such great respect and appreciation to everyone within the system and all that you're doing to help people in Kansas City and the whole state of Kansas as well.
Chris Reuter.
I just think I would remind everyone that hospitals and healthcare professionals across our community are doing everything possible to provide as much care and the very best care that we can. I think it's okay to remind friends, educate people who aren't wearing a mask, aren't vaccinated, help carry that message in our community and continue little by little to encourage those that might be holding out. We know that people make a transition. They understand the importance maybe after a period of time. So don't be afraid to continue to do that and continue to be safe. Wear a mask, vaccinate. Those are the most important things.
Thank you. And Forehead Brothers Unite. We will write again. Hawk.
Don't put your foreheads together.
Yeah, it could be a shiny moment.
I like Chris's last. Vaccines work. Vaccines still work. We get more information about that every day. If you are eligible for your booster or your additional doses, get that. If you haven't been vaccinated, I know people, please get vaccinated. There's more information coming out. We know that vaccination reduces the risk of long COVID. We now know also that vaccination, especially in those ages 12 to 18, reduces the risk of multi-system inflammatory disorder in those children. And we know people will say, well, it happens so infrequently. Again, I think that's a myopic view. Understand, if that was your child, you would want to protect them as much as you can from having those types of things. If it was one of your loved ones, if it was your grandchild, or even a friend of one of your children, you would want to protect them. And so vaccines work for more than just the illness. They help reduce long COVID. They can help reduce multi-system inflammatory syndrome in children as well. If you haven't been vaccinated, please go get vaccinated. If you're eligible for booster, please go get that booster.
You know, Jess, this is my final thought. You know, we've talked a lot of times about the intersection of faith, hope, and science, and I think people are tired. They just want to be normal. We all want to be normal. And we want to be able to take care of you right here at KU and throughout all the excellent hospitals here in Kansas City, because we are blessed by a very strong medical community. But the real message to this is that faith, hope, and science have already brought us through some of the darkest days of this pandemic. We will continue to do that. But faith, hope, and science can only work truly if you have that faith and hope and science and help us help you. We don't like deferring cases. We don't like deferring surgeries. We don't like deferring clinic appointments. Those are the things that say to you, COVID is real. And the good news is we know how to solve it. And yeah, we have to make some sacrifices to do it. But we don't want to see schools closed. We don't want to see daycare closed. We don't want to see businesses closed. We don't want to watch the supply chain make it hard to get things we all need. We don't want to have a wartime economy. What we really want to have is a better sense of being normal. Masking is not normal, but it brings us a lot closer to feeling normal than just having unmitigated spread of a virus that's wiping out daycare, wiping out schools, and wiping out hospitals. Which one feels more normal, a mask or that world in which things are truly compromised? Faith, hope, science, and common sense. Together, that's our North Star, Jess.
Dr. Stites, I love it. Thanks so much. And thanks for all of our guests today. And thank you for being with us. Don't forget, you can catch our shows anytime on Facebook and YouTube. For all of those out there who are wondering how they can help out in the community, watch tomorrow, because this is how you can help. We have yet to see the worst of winter weather here in the metro. Snow and ice, bitter cold, that's going to mean slips, falls, frostbite, you name it. But with emergency department wait times at an all-time high right now in many areas due to COVID, we are going to tell you how you can stay safe, prevent getting hurt, so that you can stay clear of the ER. That's how you can help out. So we're going to talk all about winter safety tomorrow when you join us at 8. Everyone, have a fantastic Monday. We'll see you then.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.